No, yeah, a little bit.
So we start the meeting and let's start with the round of introductions. Arvinder Singh, Community Health Coordinator for Lake Kent District. You want to go next?
I'm Diane Clay and I'm an interested party.
Francie Winters, Prevention Coordinator under Lake Health District.
Judy Clark, Public Health Director.
Kristen Hill, Facility Navigator, Lake Health District.
Jack Thompson, Superintendent for Lake County ESD.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Alana Shamula, Program Coordinator with the Eastern Oregon Healthy Living Alliance.
Susan Campbell, Clinic Manager for Lake Health County.
Christy Albertson, Grant Writer for Lake Health District. And Jamie Davis, Oregon State University Extension Service.
Garrett, would you like to introduce yourself?
Sure. Garrett Shaw, Lake County Examiner.
Thank you. Could you guys over the phone introduce yourself?
This is Shelley with the Lapine Community Health Center in Christmas Valley. This is Maria Waters, Regional Outreach Coordinator for the Oregon Health Plan.
Awesome. Thank you, Shelly and Maria, for joining us. So, before we do we go through the minutes and the agenda. So I was wondering, we have never done this before. I've never asked an icebreaker question. Seems to be really popular in every other meeting I've been to.
There's a lot of ice still.
So I did a lot of in-depth research and Googled it.
I'm going to say about 3 minutes.
So the question that I found interesting was, so if you were to wake up tomorrow and turn into an animal, which animal would you want to turn into and why? And we will start with Diane. Okay, so I'll start. I don't think
I'm going to take a bite of cookie myself.
So I'll start. I've not given it much thought, honestly, but I think I would want to be a polar bear so I can withstand the harsh winters in this side of the country. They can withstand, I'm guessing, right? Anyways, so polar bear.
Yeah.
You want to go next, Diane?
Sure, well, I'd like to come back with my dog. I mean, he gets pampered and taken care of very well.
I think I'd like to be a griffin. Can I do that? Does it have to be like a real?
No, it can be fantasy.
You know, you got like a horse, lion, flying, all that. I think that'd be cool.
I think I'd be a cat. I want to be the boss at some point in time in my life.
Yeah,
The cats definitely are the bosses.
I have them too, and they're boss.
Yeah.
I'll go with eagle, fly through the mountains.
Nice.
Maybe a duck-billed platypus.
Platypus.
Because everybody loves them. They're cool, you know? It's like,
Like their tail.
Garrett?
Am I going? An otter, because it looks like they relax a lot. That'd be nice.
Seem to be having a good time all the time.
I'd say a thoroughbred racehorse, because I'm not pulling no plow.
They are good.
Probably some sort of jungle cat, like a panther or tiger, something like that. They're
Why?
pretty badass, I think.
Have that reflected in the minutes.
Word for word, please.
I think I would want to be a boxer because they are very sleek and thin and muscular and they're always happy no matter what's going on. They're happy and positive.
I am going to go the opposite of that, and I'm Team Judy for house cat, a big fat house cat that just lays around all day.
Some days that sounds good.
Yeah, I think I want to be a lab dog because they go from like 0 to 60. They can be super chill, but then they're always like ready for fun and hiking.
Yeah, good.
Leanne, do you want to introduce yourself and also answer the
The question, okay.
I'm Leanne Davis with the Lake County Youth Mentor Program. And the first thing that came to mind was I would want to be a leopard because they're fast and sleek.
Yeah, fleet.
Yeah.
Excuse me for being late.
Shelley, do you want to go next? Hopefully you heard the question.
Sure. I'd like to be a bird.
Nice.
Just to fly around kind of above and see everything that happens below. And I don't know, they're always outside. They never seem to be cold, and they just go out there and kind of do their thing.
Thank you. Cece, you want to introduce yourself? And I asked an icebreaker question: if tomorrow you were to turn into an animal, what animal would you want to be and why?
I'm Cecilia Montgomery, Cece, and I'm here for seniors and the auxiliary at the hospital. And if I had to turn into an animal, I think I would turn into like a tiger or a big cat, for the simple reason I'd have the power to look at. Nobody knows what their feelings are, and they wouldn't really know what I was, except that they, hey, beware of her.
That's been one of our most
That's
popular
how it's
answers.
supposed to say.
Simple route.
By the way, Cece, because you came in late, you're the new president.
Okay. As long as
All in
you,
favor?
Yeah, isn't that what happens when you're late to a
as
meeting?
long as you have patience with me, I will try.
Thank you, Cece. So I think we'll go ahead and go through the meeting minutes for a few minutes.
Are you guys still there?
Yeah.
Yeah.
Yes, is this Maria? Do I have a motion to approve?
I have a correction. When we are talking about under grants, the first grant is Narcan, not Norcan. I don't know if it's a typo, but it's important.
Thank you for that.
I just have a brief update. We were collecting data from various sources for the community health assessment that we'll be bringing out to you. And we got the CRAMS data, which is a survey of women who have delivered a baby in the past year, a random sampling. And at the bottom of page 1, it says 28.8%. For 2017, it was 48.6%. So we went back to the people at the state that control that data. It's run through the Centers for Disease Control to make sure that we had it right. They couldn't give us individual county information because it was too small and not be identifiable. So we had them run it for the 12 Eastern Oregon counties, and that's what it came out at. The state was still around 23%, So these are women who have had depression during or after pregnancy. And those kind of numbers are pretty scary. It's 1 year, so it could be a blip, so we've requested a data agreement with them to get 5 years worth so we can average it over time to bring it out. But, you know, kids with moms who are depressed have lots of other issues that we're going to see later on.
Sorry, Paul, I didn't quite catch the first part, that 48.6, just Eastern Oregon, did you say?
Yeah, it's just the 12 counties in Eastern Oregon. And we went back to the guy and said, "Are you sure this is right?" And they ran it again, and sure enough, because that's a big jump.
So I'll submit the changes to the meeting minutes. Apart from that, do I have a motion to approve?
Yeah, make the motion.
Thank you. Do I have a second?
I'll second.
Thank you. All in favor, say aye.
Aye.
All against, say aye. Okay, the meeting minutes have been approved. So we'll start with the agenda items. I think John is not going to be there. Do you want to give your updates? Thank you,
I've
Alana.
just got 2 quick little updates since I know he did his whole spiel last month. We did the Youth Mental Health First Aid up in North Lake on November 30th, and that went really well. We ended up having 11 participants. 6 were from North Lake. We had 3 law enforcement, and then 1 person came up from the extension office. It was just a really good training. It went really well. I was actually really impressed with how they handled the conversation and what they already knew. It was really good. So our next goal there is to work with our youth mentors down here and try to get a training scheduled after the first of the year, after the holidays and everything. And then I just wanted to give a quick update on the HEAL program, Healthy Eating, Active Living, particularly the active living side of that. We're going to be implementing Hike It Baby in Lake County. We've had some changes in our program timeline and everything. And I'm actually going to be heading up the Hike It Baby, the hiking program in Lake County. And I'll just be working closely with our other employee up in the Baker area. So I just wanted to let you guys know that's still, we're still working on it. We are in the progress of developing all of our materials right now, and then probably sometime in January, February, we will actually start implementing, reaching out to people and getting the group going.
Thank you. Do we have any questions or comments? All right, so I'll give it to you next, Paul. Do you want to?
Yeah, I have 2 things to report. We got a lot to do today, so I'll be as quick as I can. The first one we'll cover is the December Measure Progress Report. The front cover page that Arvinda gave you is for all of the EOCCO, but we mainly focus on the second page, which is just for Lake County. And again, we do have that piece of information that was not in the reports before, which is where you were last October, the 2017 rate. You can see that you're over that for where you were with the adolescent well care visits, but we still need 44 adolescent well care encounters at the clinic to meet the measure. Susan, you got anything to add in about what activities may have been going on? I know we had the school.
Yeah, we have the teen health fair since 10/31. I think we also, did we complete North Lake Teen Health Fair since 10/31, or was that in October? It was in October. That was in October, so they may have a few more that come through. We have a few that should be coming through, which would also impact that dental sealant measure as well. We did dental sealants at our teen health fair.
Right, Mary Ann Rand reported yesterday or Tuesday to the Harney CAC that they believe that they have met the measure for all of the EOCCO, and they have been in schools down here, so expect this number to improve. On childhood immunizations, Beth, is there anything there on those 2 more that we need, or?
We keep calling, and
Okay.
if they pick up, we ask them to come, but I know the doctors are doing the same thing. It's the same issues, no phone number, don't care, don't come.
Okay.
Yeah, but we're working on it.
Are those two aged out, or are we could we still get them?
I don't know. I run reports, we call whoever looks like they're due, and I couldn't tell you specific names. I don't know what 2 kids that would be.
And when their birthdays were, if it's,
I think we might have missed them,
Yeah,
because we've had the same 2 for a while.
okay.
Oh, have you?
Well, you need more than 2. There's actually 6 that haven't been immunized, but
Since we have 2 to meet the target.
well, 2 to meet the target, but
Right.
there's 6 that are
Out there
missing.
that we could grab. Mhm.
And it's when they turn 2 years old. So they'd have to be born December 13th to 31st.
Right.
I was at the health fair, and I had a bunch of kids around me, and they were talking about how they tell their parents if they're gonna get the immunization shots. Because I was talking to him about, hey, just go and turn left, and
Yeah.
you can get that all taken care of. And she says, oh, I said, you talked to your mom about this? And she says, no, I don't need to. She'll just go along with what I say. So that's one of our problems.
Well,
We're not getting to the
if they're
care.
15, they can self-consent to any health care. And the other piece is this is just focused on childhood immunizations, the 2-year-olds and the ones that public health department were, I'm guessing, HPV and
Yeah.
what else?
Yeah, for the older ones, you mean?
Yeah.
Yeah, they can do meningococcal HPV. They can do any of them.
Okay.
As they're older. And we frequently do have teenagers come in and get their own vaccines.
I have a vaccine question for you. I was just recently told that if we build out flu shots for EOCCO children, that they were being denied because those children should have been vaccinated at Vaccines for Children site, and so those claims weren't being paid. Is there anything that we're concerned about? I mean, we think we should be able to just vaccinate kids as we can.
Yeah, the flu shot.
The flu shot, but
So-
there are claims are being denied.
Yeah, have you reached out to Sarah and Courtney?
That's what I wanted to find out, who do I ask?
Yeah, actually, it's probably Summer,
Summer.
if you met her.
Yeah.
She'd be able to make the intervention quicker.
Paul, I had a question. So what's the deadline for capturing the last 2 or 6 immunizations? Is that
December 31st.
Okay.
Yep. And we won't know fully until the end of March, you know, what claims have come in. Again, these are just claims-based measures that we can look at.
Yeah.
Developmental screening, these are for kids 36 months or under. Still need 30 of those. Effective contraceptive use, 9 more. And,
That was dental sealants, you read.
oh, developmental screening's 19.
Yeah.
And then 9 more for effective contraceptive use. And Susan, the women who were in the past identified as having tubal ligations or hysterectomies are in your denominator now.
So they reviewed our report?
They said that they have moved them into the denominator. So there may be a search again at the end, depending on how close it is. And then the other 3 measures we are meeting still. Any questions on the incentive measure report? And a reminder to those of you who haven't been with us all the time, this is where the money comes from to support all the grant activities if we meet these measures. I wanted to give a brief report on the results of the qualitative analysis that we conducted here in Lake County. We did 2 focus groups. It was mailed to Shelley and Maria, if they're on your mailing list. If you can make sure Kathy Pike gets a copy of that, and she's on the...
It's no longer available.
Oh, no? Okay. Well, anyway, I'll just give a report on this. We conducted 2 focus groups. I think it was the second and third one that we did out of 20. So these were back in May, late May and early June, up in Christmas Valley and down here. It took a while to do the other 20 across the region, and we also conducted 4 Spanish language focus groups as part of the assessment effort. The way that this is structured is that the beginning of the report is for all of Lake County combined. If you look like in the beginning of table 1, you'll see a little quote that says it came out of the Lakeview service area. Then it may say Lakeview again in Christmas Valley. So what happened was the tapes were transcribed, and then we created buckets of context codes that Jill and Jorge would highlight using the MD Max QDA, which is Maximum Qualitative Data Analysis. And then they would highlight part of the transcript and then assign it to a certain bucket. And what happens is after a while, you start seeing patterns emerge. And so where it says high coverage topics, there were lots of discussions around that. We tried to pull out quotes that related to that and help reflect all of the things that were said in that particular focus group, but certainly gathered what we were wanting to see. So in the bigger heading of social and community context, community programs were mentioned a lot in both focus groups, things that you're doing that you're proud of. Not mentioned here, but brought up was the summer lunch program, but we highlighted a few, the theater project, the self-management courses, and the personal hygiene activities that are happening up in North Lake. The next page, we're talking about community norming, and in this case, it was a positive community norming. In Harney, even though we say community norming, it doesn't, if the norm of the community is a bad behavior, then it still fits into that context. But I think this, Christy, this serves you well for emphasizing the Outback Strong program. No doubt about it. It just lines right up that, you know, people being accountable to one another, doing things in groups, the walking program that Alana is mentioning, you know, any of these activities that involve lots of people to do something and keep each of you accountable for things. Health behaviors were there. Again, this was a little more positive. In some of the focus groups, it was more negative health behaviors that were identified and people not wanting to go to the doctor for anything unless they were sick or broken down, not emphasizing the preventive services. Healthcare availability of healthcare services. This is different than access. So availability means, is the service there? And then you worry about whether people can get in, and that's when you're talking about access to services. So we did talk about, highlighted the telehealth project, and up in North Lake, the availability of more mental health personnel, end quote. Vulnerable populations were identified. And then at the bottom of page 2, what you'll see is kind of a summary of the big heading of social and community context that leads you through those areas and other points that were made in the focus groups. Then on page 3, table 2, we talked about specifically the social determinants of health. Poverty was a big emphasis in both areas, and people sure do understand the connection between having a job, family, having transportation, having basic resources, and good health outcomes. So it's pretty clear that that message has been delivered in Lakeview and in Christmas Valley. Stability is a big thing. And then there was, at the top of page 4, stigma and discrimination against vulnerable populations. Again, I think at one point we did talk, Christy, about mental health stigma and using services. So, I mean, if there's any activities there for next year for the plan, we should keep it in mind. At the bottom, the social determinants of health. I don't know what happened. I'm the one that conducted both focus groups, and somehow both recorders stopped at exactly the same time in Christmas Valley. So we lost about a third of the transcript and couldn't make any additional comments from there. So I apologize for that. But went back and listened, and both of them just, I didn't turn them off, I know that. If you go to page 5, that's the protocol we did, 5 and 6 and 7, and then at the appendix C, there's additional information related to Lakeview specifically, stuff that came out of there around health behaviors, vulnerable populations, economic conditions, including the quality of water in the community, and housing came out, which it looks like we have something on our agenda dealing with that a little bit later. So, and then again, appendix D was Christmas Valley additional topic areas, but combined are the ones in the front that basically fit all of Lake County, and then the unique pieces of Lakeview and North Lake are reflected in appendix C and D. I think if you read it, if you have a chance to read it, you can, ask me questions at some point. I'm sorry that we didn't get it out a little bit earlier, but we're working like crazy to crank these reports out for all 20 of the focus groups. So, any questions?
I have one quick one. At the bottom of page 2, when you're summing everything up, something was mentioned about a physical activity program that aims to serve Native Americans.
Yeah, I don't know what that was.
Yeah, I know.
Is that up north?
But we don't have a huge population anywhere in this county.
We don't.
It's, Shelley, do you know of anything happening up north about something targeting Native American kiddos? Or I guess maybe not kids. Physical activity program targeting Native Americans?
No, I'm not aware of anything.
I can go back to the transcripts and see. I'll circle back and get back to you on that. There are opportunities.
It may actually, sorry, this is Maria Waters. NARA was doing some work in Lake County, and so it may be someone from NARA that reached out. I'm not sure.
Thank you. I'll check on that though, Christy. I mean, there's also the opportunity, the chance that what the person transcribing, hearing the tape heard was different than something else too.
Right. That's what I wondered.
The other thing that I'll point out is we had a great big debate about whether we should change the tense if somebody spoke incorrectly or not in terms of what verb they used in in the quotes, and we tried to keep it as straightforward as we could. Just recognize that we did that on purpose. So this is our qualitative assessment for the community health assessment. Over the next couple of months, we'll be bringing updated data. I'm assuming that public health needs to do their community health assessment.
With the year that I've been there, we've not done one, but we piggybacked onto the hospitals.
Okay.
Yeah, so we're with the hospital on that.
So we're still trying to, we did that last 2 years ago now, where we had the input from a broader group than just this. We did it at the Elks Club, and that met the requirement that the hospital has for the federal government to produce a community health assessment and a plan. Mental health is required this year as well to do it, so we'll need to bring that in. If you wish additional qualitative work, around, we didn't ask people, what do you think about the hospital? If they brought things up and talked about it, it was because they initiated. Whereas if you were doing a focus group to look at services at public health, you would want to ask more specific questions. I'd be glad to help you if you gather the people when you want to run a focus group or something.
Since mental health is underneath the Lake Health District, are they also going to piggyback with that?
Well,
or would that be acceptable?
That service needs, it would probably be acceptable, but again, you're not getting programming data about mental health, although there's a bunch of mental health quotes in here. Not so much public health coming out.
Paul, do you know what the deadline is for the assessments?
Say it again.
For the needs assessment that we want to carry out?
Well, we need to finish 12 individual local community advisory council plans and a regional plan by June 30.
So you need our assessments done before or well before that? So maybe spring.
Yeah, we're hoping that like April, in that time period, you guys would have an updated plan that we could fold into the other 11, you know, for the regional plan, and then that's really kind of what drives a bit of what Eastern Oregon Healthy Living Alliance goes after. So we'll go from there.
Sorry, you said plan, is that assessment? Did you help use assessment or
Well,
strategic plan?
first we do the assessment, and then we have to have a community health plan.
Okay.
They dropped the I in improvement. It's just a community health plan. And then, as the minutes reflected, we have to have at least 2 areas that match the 14 areas that the state has identified for their state health plan. If you get a chance to read it and have other questions, let me know.
Paul, I just had one comment about the incentive measure report.
Sure.
So the target for the developmental screening in 2018 is 65%. So I was going through the records, and in 2012 or 2013, the target for developmental screening was 11%. So it has increased a lot over the years, unlike the other incentive measures. Do you have any information on that, and do you know if it's going to increase for?
You mean why the big jump?
Yeah.
Mainly because people were over the target.
Okay.
'Cause, I mean, even 38.5 last year to 65.6 this year is a pretty significant.
It is a big jump.
This is how we did, not what the target was.
Oh, I'm sorry, this was target. Oh, I see, sorry. Okay.
Do you have a guess as to what it might be, the target might be for developmental screenings next year?
They haven't released any of that, but generally speaking, you can add 3% to all of them.
This one has gone up by like 10 to 12 every year, so I didn't know.
But if all of the CCOs start meeting a measure too much, then they raise the bar again.
Well, that's not very nice.
Well, we're still missing lots though, right? I mean, we know that kids are generally having a developmental screen. The issue is that it has to be reviewed by a primary care clinician. So even though the early
And it has to be a
learning.
certain tool, and there's a lot
Right.
of hoops and documenting.
True. But we put some resources in that. And if you go back to page 1, we've already met that measure for the entire region. So lots of places are doing that. And it catches kids early, it gets them into wraparound services and into the therapies that they need if mental health services are needed as well.
Thank you, Paul.
You bet.
So next I'll start with
one more thing.
Yeah.
There was a joke. Poor CC was getting, but remember to think, next month we need elections. So if you're interested in a leadership role, think about it and let our vendor know.
Thank you. So next to the chip updates, the main update is that we completed both of our teen health fairs in Lake County. So I have the numbers in front of me. So for the North Lake Teen Health Fair, around 145 kids showed up, students showed up.
How many was that? I'm sorry, 140?
145. And 90 of the students had completed their passports. So for the Lakeview, our numbers are, we had around 110 students that showed up at the fair, of which 40 were from Paisley High School. So our number of the Lakeview school students is quite low this year. And of the 110 students, 60 students completed their passports. So yeah, we had mixed reactions about the low turnout of the Lakeview Teen Health Fair. Last year we had crossed 150 students at the Lakeview Teen Health Fair, and all the students were from our schools. So earlier this week we had a debriefing meeting just to get all the partners together and discuss what went well and what did not, and how we could improve it next year. So one of the main reasons we found out why our local student attendance was kind of low was, so I got feedback that we could have done better marketing of the Teen Health Fair. And also, we found out that the schedule for the buses was not changed. So what ended up happening was that most of our students, so the health fair started at 1:30. So the way we had planned it was we wanted the Paisley students to show up first, and once a majority of the Paisley students showed up for the fair, and then our students would show up so that the flow was kind of smooth and the stations were not overwhelmed. So the time for our school students was around 2 p.m. To show up for the health fair, and that coincided with the time of the school buses leaving the school. So majority of the students had to leave. But definitely, so we discussed this issue at the meeting, and we still have a very good relationship with the school, and also Christy has suggested that we would have a checklist before the teen health fair, so just to make sure that we haven't missed out on any minor details. And so that was the brief, the summary for what the meeting was and how we plan to improve it the next year. There were many things that went well. I think the giveaways were really liked by all the students this year, this time around, and even by the stations. We all felt that the event ran more smoothly than last year. Because last year was the first time we were doing the health fair. We did not know what to expect. This year we were a bit more prepared. The flow was more smooth. If the stations ran out of their items or they needed some help, we had student helpers over there ready to help them out. So that all went very well, which we're going to stick to for next year. So that's the update for the health fair. I don't have any other major programs that require updates. I'm still working on the Gatekeepers program, but I wasn't able to send out the bulk of the surveys, the second round of surveys yet. So I don't have much to share about that. So that's for the CHIP updates. Then I wanted to give a supportive housing update that Christy and I have been working on. So many CHIP meetings before we had we had shared with the council that we wanted to work on supportive housing for the homeless or whoever needs it in Lake County, and a plan was started to what all community partners need to be there in this plan, because it's definitely a big project. It's definitely going to be out of the scope of just for the hospital to lead it. So there is in the packet that I've handed out, there is a blue color, we have a housing checklist. So it just gives you an idea of what supportive housing is, what our vision is, and below it also shows the partners that are involved with the supportive housing plan. So up till now we have had 2 meetings for the supportive housing plan with our partners, and the next meeting is going to be next week on December 18th. So I just wanted to give an update, share with the council of where we are with the supportive housing and what discussions we have had in the meeting. So the partners have decided up till now that we wanted to put this project under a 501c3 umbrella, so that it's a non-profit organization. And we also wanted to put it under the Outback Strong banner. And why we decided on that was because the group felt that there might be some negative reactions if the community feels that the district or the Klamath Housing Committee the Klamath Housing Authority is leading the charge. So we wanted to put it under the Outback Strong banner.
Can I add a couple of things on that? It hasn't formally been decided whether we're going to try to turn Outback Strong into a 501c3. It was one of the options that was discussed, like our vendor said, to avoid any negative reaction the community might have to Lake Health District, whether we're seen as taking over something else, or to Klamath Housing Authority, because they had a big fight when they were putting in the commons, and they have kind of a negative reputation here sometimes too. The other benefit of the 501c3 all of the partners listed on that sheet are public entities. So if we go after funding and one of us is the lead, then we're subject to Davis-Bacon laws, which contractors are already crazy expensive, but Davis-Bacon adds a lot to that. So this would be a way to kind of lower costs for the community. There are ways to do it if we got all the partners involved to form an LLC, and if we went after a tax credit, then we would try to get a bank or some kind of private entity to buy the tax credit so that they, if they own 50% or more than 50% of the project, of the tax credit, of the funding, then we're not subject to the same kind of restrictions that we would be if a public entity is the majority owner. So that was kind of a little more of a background for that.
Thank you. The other things that have been discussed in these meetings is regarding the data collection and the challenges it poses. So the KLCA, which is the Klamath and Lake Community Action Services, has been doing the point-in-time homeless count each year. But through the discussions, we felt that the numbers that they show are not always that accurate. So officially, the Lake County's homeless population is 3, which we felt was inaccurate.
Sheltered or unsheltered?
So I asked, sorry, I'm gonna jump in again.
Well,
because
the data that we're bringing on certain pieces of housing for the assessment had a source that broke it out by sheltered, unsheltered, how many were kids, and how many of the kids had their parents with them, or were on their own.
Right. So I just talked to, class has a new homeless coordinator, I don't know what her exact title is, brand new to the job, is still trying to learn everything, and I just talked to her last week about this point in time count, and she is so buried that she hasn't really had time to devote to it, but I explained to her how we have 3 homeless people, and she's like, well, I've been here for 5 minutes, and I know that's not right. So she looked up what the definition is that they use, and it's everything, it's sheltered, unsheltered, it's the definition that we are using on that handout, I don't know if it's on the handout. Yeah, functionally homeless. Basically, if you don't have any control of your housing, if you have one bad interaction with whoever your landlord is, if you have no legal right to anything, that counts, couch surfers count, all of those things count for this. And the further conversation that I had with this gal last week, the reason the point in time count is so inaccurate is because it happens at the senior center and people come in and self-report. And we have a lot of folks who are trying to stay under the radar, or who didn't get the memo that they need to come to the senior center. It's a pretty poor setup. And the way a lot of other communities do this count is they physically go out and they count people. So I'm giving you all that heads up now because I'm gonna ask our vendor to put me on the agenda next month to talk a little bit more about the vision behind Housing First. There's an awesome video that I want to share with everyone. But I'm also going to be recruiting some people, I hope, to actually go out and do that count with us in January.
I think you should get on the staff meeting agenda for, oh, you said you didn't want to work through wellness because you didn't want it to be an official person. But
for now, this is just physically going out and counting bodies. Okay. So it can be anybody.
I would I would come to a staff meeting there and ask them because I think that they have big skin in the game.
Yeah.
And that they're very committed and they've been talking about it for a long time. They just haven't been to these meetings for a while.
Yeah.
And so I think that I did mention to them, but it would be better coming from you.
Well, and we'll be the housing.
Oh, go
Go
ahead.
ahead.
This is Shelley with the Lapine Community Health Center. Christy, could you give me the class contact that you were speaking about
Yes.
for the PID count?
Yep, I absolutely will.
Okay, because I've reached out to them twice via email, and just in general letting them know that I'm the lead contact for South Deschutes County, that I would like to collaborate, and if they could give me the surveys, we have the health center would be more than happy to fill them out for our clients, especially in Lake and Klamath County. But I've never gotten a response back.
Yeah, it took me several weeks.
There are community partners that want to help with the PID count, especially in Lake County and Klamath County, but it's just getting the organization to communicate. So I might have I had the contacts from last year that were given to me.
Gotcha, nope.
So I might not have the right email, so if you could send that to me, I'd appreciate it.
Will do.
Are schools still required to kind of do the numbers?
Yep.
And you happen to remember even close to where you're at?
I don't know.
Okay.
I'm not sure what they are for homeless.
Who's
Yeah,
in
no,
charge
schools-
of that title it was Steve Prock, but took over when he
I
left.
think it's Brandy Harris is at the high school. She'd be a starting point anyway, asking that question.
And then the other thing is, we are changing the constitution of the state of Oregon as of the election that allows municipal entities to use bonding authority for buildings. And so I'm not sure how that works with a 501c3, but, you know, local resources are probably your best shot other than the federal housing dollars.
Yeah.
So I don't know how that'll mix together. The other piece of it is just, I mean, I can understand the concern about Lake Health District, but if you look at the Oregon Revised Statutes and what powers a health district has in Oregon, they're a vehicle for all of this stuff.
Yeah.
All of the social determinants of health, they could do it all. They have the authority if they wanted to.
But then you'll need a separate one for Christmas Valley.
Well, no, Christmas Valley has the North Lake Health
Yeah, they
District.
have a health district.
Oh, okay.
But that, you know, again, they have the ability to bond and, you know, do capital projects if they want.
So if someone is homeless, are there any resources currently available, like a community action agency they can go and get?
That's the last,
Yeah.
the community action services. So I'll send you her contact
Okay.
information too.
They came to a coalition meeting some months ago,
Okay.
but that lady, Julianne
Julian's
Dubois,
Yeah.
is gone, and now there's someone else there.
Okay.
Excuse me, and they came and they said, yes, we understand we cover Lake. We understand we don't have a big enough footprint. We're over here, but it's hard, and
I think I was at that one
Yeah.
because I was talking about the kids, I think.
yeah, so that's kind of where that piece is. What we got out of that was the 40-hour-a-week energy assistance person, but we didn't get anything specific that changed on the footprint of the homeless
Right.
rep.
Another thing that, I don't know if it's this group to take on, but just something to be aware of while we're talking housing for the Klamath Housing Authority and the low-income housing that we have here, because they are Klamath Lake Housing Authority, they have one list. So if you are in need of low-income housing, you will go into this communal list. They don't have a separate list for the two counties, which seems insane to me. This is my professional opinion. But that might be something that we ask them to reconsider
Yeah.
in the future, because like the Lakeview people want to stay in Lakeview and Klamath, they're not gonna come to Lakeview, so.
And maybe Paul would know how this happened, maybe, or who we talked to, but it seemed that when class was here talking about these challenges, they said that they had applied for grants that were specific for Klamath, and then no one applied for Lake. This was some years ago. And so therefore, the state or whoever said, we'll give, but you have to cover Lake as well, we'll give you some extra money. We'd like to know who it is that we approach to say, let's not do it that way anymore, it's not really working out very well in the best interest of Lake County, and find out who we advocate with to make a change with that.
Yeah, I would guess if you're talking about channeling resources, and the governor's budget has more in it for this coming biennium for housing, but it would be Oregon Housing and Community Services. And I'm guessing, I hope I'm not speaking out of turn, but usually that kind of stuff is run through the county courts and commissions, that they would say, no, we don't want it, but someone else can get it. But you know, the state usually works with the county in that kind of decision.
So we'll talk to them, and then we'll talk to our new commissioners, right? Okay.
I'm impressed though. You guys should be happy that you're getting into it, and You know, when we combined all of them, which we're gonna, the focus group report for the entire 20 English-speaking ones is gonna be delivered at the RTAC meeting on Tuesday. I mean, housing is huge, and it's also one that the state health plan has added as one of its potential areas, although it's pretty big, as you guys are realizing. So, I mean, even if you're taking a piece, supportive housing,
Yeah.
it's admirable.
Which that's the good other thing to keep in mind is this is just one small project. Need is massive in Lake County, and this is in Lakeview, so it's not even getting into the north end or needs anywhere else. And we talked with Gloria Stringer at the crisis center, and she pointed out that what we have set up here isn't gonna work for her clients, and we know it's not, we need something for crisis too. We know, we need to start somewhere.
Right.
Thank you, and that's mostly what I wanted to share, and again, as Christy had mentioned, that nothing is finalized, and we're just throwing ideas and are in the discussion phase, but I'll keep the council posted with the updates. Christy, do you want to?
Yeah.
The updates?
I have one sad update, the Outback Strong Fresh project that we've been trying to get funding for to get the community gardens and get different health and nutrition related stuff. We were rejected for that. Can I ask if you guys were successful? You also applied to OCF for funding for their community projects or something for the HEAL. Did you guys get?
I don't know. We haven't had an official sit-down meeting. I don't know how funding is going with that.
I'm just curious. So if not, maybe we should team up and figure out.
I do know that, I don't know if it's OCF or if it's another entity, but I do know John's been having trouble even just like getting them to continue with the process. It's been a lot of talking, but not a lot of doing. So that's part of why our timeline has changed, is because there was a delay in getting funding that we wanted, but I don't know, I can't remember if it was OCF or Ford Family, I don't know that.
Okay. Well, that's another thing, and this is just, it's not a minor thing, but kind of a minor thing. So Francie and I next month are meeting with a guy from the Ford Family Foundation to talk about possible funding for a project that Francie is doing up in North Lake with her kiddos and trying to take them on the road. I don't know if you want to give a quick overview of that project.
We're so far away. I think you guys have a pretty full agenda, don't you?
Yeah.
How are we doing in time? We're good?
Very good.
And I don't know if you want to or not. I hate to put you on the
Just
spot.
quickly, North Lake kids, I'm working with Life Skills with Positive Action for the last 10 weeks. We're working with a drama class that is largely made up of the alternative kids. And they have indicated an interest in creating a youth-to-youth advocacy type show, like I have done in the past in Southern Nevada. And they're going through the process of figuring out and identifying what they believe their issues are in their school and creating some kind of positive social norm message for a t-shirt kind of a thing. They have voted, they are going to do it. We're going to do it in the summer and in the spring. It's a question of how much and what level as far as equipment goes, you know, because we have to be able to basically do the show whether we have Ford Foundation or not, the way the funding works. So we're working on that part, but then we'd like to tour it down here to South Lake and do the same show. Part of that being an encouragement to get South Lake kids to create one of their own. That's how it's worked in the past. In Nye County, it was a long, skinny county, hundreds of miles away from each other. And we ended up with kids in 3 different towns that did the show or various versions of the show, and they got together, and it was a really awesome support group for them to have clear across the county. It certainly made kids that felt like it was hard for them to be accepted feel like they had a support group much more strong. And it just seemed like it worked really well all the way around. And the opportunities for them then became to tour regionally, to tour statewide, to tour out of state to national conferences like Youth to Youth and places like that, where they could go ahead and bring their message and show what they were doing. And And that gave them, I mean, it really lit a fire under them to go out and do those things and get that kind of experience and esteem. Kids that were coming from a rural background, feeling like they were really being heard. And my kids came back from Youth to Youth in Ohio, and I guess this was like the third one that we'd gone to. And they were so stoked. They wanted to recreate what they had done there and recreate it for our own region. And I'm like, you guys know that's a whole bunch of work. And they're like, we don't care. We want to do it. We want to educate all of our kids and get them to see what we had happen there and see how positive it is to be for a week with adults who are supportive of kids and positive and all those things. Their norm there in that area was different than our norm here. Those kids felt not valued as young people. And I don't think that's true in South Lake. But that was really a big deal for them to feel like they mattered and they were valued. So that's what we're working on.
The big thing that I have is this sheet that you guys have in front of you. It's a review, kind of an outline of what we're proposing for our LCAP dollars next year. This is the grant that we don't have to compete for. The money is based on how well we did on the incentive measures in 2017? 18?
No, 17.
Okay.
Yeah, I'm sorry.
But we still have to present a plan that EOCCO says is acceptable. So we're dividing the money this year. We're putting some toward addressing the incentive measures that make us money and some toward addressing social determinants of health. So for the developmental screenings, the kiddos 36 months and under, we are going to continue the program that we've been doing for a few years where our clinics give out diaper packages to parents who bring in their little kiddos to get screened and have that questionnaire, the ages and stages questionnaire, looked over by a provider. This year, we are also, this next year, 2019, public health is going to be able to do that. We have one provider there, a physician assistant, so we'll be able to add that fourth location, which will be great and help the measure because so many kids come to public health to do the ASQ and they have not had a provider who could look it over, so we weren't meeting that measure. You have to have that provider piece. So that will continue as normal. Prenatal and postpartum care, so Lake Health and Warner Mountain clinics this year in July, started offering Amazon gift cards to women who come in for their first prenatal appointment during their first trimester, and for women who come in for their postpartum appointment within 21 to 56 days of delivering. And now, can you talk a little bit about how it's gone since then?
I threw my numbers up at well, it's been pretty successful. I think we've gotten cards a couple of different times from Sing, so kind of RN in the clinic that tracks it, and we've been pretty successful, I believe, in getting those early prenatal appointments scheduled. We've kind of been able to sway some of our providers to kind of revamp how they normally do their prenatal care. So that's been a positive thing for us, and I did actually get an updated OB count today, and even though we just had the baby boom like a month ago, I have 41 pregnancies in my clinic right now that haven't delivered. So that's significant. I don't know how many we are here today. We usually average about 60. I know in January I had about 35. So now that we're in December, it's been almost a whole year, I still have 41 pregnant. So lots of babies in Lake and Modoc counties. So
Bonds for new schools coming.
something.
So just to throw it in there, why don't you just throw in effective contraceptive use
Oh, that's smart.
under that measure?
Yeah, because we're meeting some of them have come back in condom because they're getting their IVs placed up there just for
Excellent. So we are adding Christmas Valley to this next year. They don't have as many pregnant ladies, but they do care for some, so we want to make sure that those women are getting in at the right times. I still, and correct this, I have it written in there that are, so right now we have public health emails. If anybody shows up in public health with a positive pregnancy test, then they are emailing the Lakeview clinics to get the ladies set up with their appointment, the prenatal appointment. Judy cleared it with Christmas Valley that they will call, right, public health up there.
Yes, they do not
If
want
sees
emails.
anyone, then, so we'll have that system set up. For the other end of things, the postpartum, is the hospital, are the OB nurses or someone emailing you guys?
That isn't exactly, I don't think, how it's happening. Typically, we're scheduling them when they come in for their weight color check.
Okay.
We're trying, the MAs are trying to get moms scheduled at that point. And then also Deborah runs a tracking from when they delivered, tracking to make sure that they get a follow-up call to remind them to come in. I mean, but usually we're able to catch them because baby's getting a 2-week and a 1-month well child. So we try and, that one month well child, you know, we're selfish if we get to hold babies while mom has her postpartum checks.
So are we doing something with the depression issue in this?
Well, that gives us the opportunity when they're here to again screen them with the depression screening tools. And I think typically that's part of that postpartum check, is that the providers are checking in with them to see how they're adjusting to having a baby or two, depending on what we've been having. So yeah, the providers watch pretty closely when they're coming in for those postpartum checks. And the MAs are asking questions when they're rooming them for well child checks. How are you doing? How are you adjusting? So they're trying to keep a good eye on them if they're willing to talk about it.
Up at Christmas Valley, because they're part of a totally different health district, they're not driving all the way down here to deliver babies, they go to Penn. So Christmas Valley, the process is they follow up on the discharge notices that they get from St. Charles. So that's that game plan for that incentive measure. The weight assessment and counseling for physical activity and nutrition, which we shortened to childhood obesity, because that's a mouthful. As of November 1st, I think, is when our Lakeview Clinic started using the template for that, right, in their EHRs. That was the game plan last I knew for the report, so we're gonna go with that. LaPine Community Health Center has had something in their EHRs for several years as part of their well child checks. So we should have numbers for 2 months by the end of this year that we can kind of base, and for an entire year from North Lake, that we can base our target off of for 2019.
The BMI piece, but the counseling piece was not structured data, so we couldn't pull, right? Like the counseling has been happening, but it's just typed in, I spent this time to this time counseling on, and we can't pull that.
Yeah, because as a patient-centered primary care home, both clinics have had to do the height and weight assessments.
Yeah, we've been doing BMI, like it's probably like 99%, I mean, yeah.
So part of our plan to address this incentive measure, and it ties into our plan for the social determinants of health piece, is Lake Health Clinic is going to create a movement class that providers can refer their patients who need that physical activity. Once they get that counseling piece, they'll be referred to this movement class that one of their MAs has a degree in kinesiology and is really gung-ho about getting some classes going. So he's gonna help figure out what these classes need to look like, and we're gonna get kids and families, and we can get families into these classes, whatever they may look like. We don't know yet what they're going to look like. As part of that social determinants of health piece, Jamie's not here, but I think she is the one who brought up originally that we have kind of a dearth of activities for families, opportunities for families to be active together. And she pointed out the kiddie park as a prime example where kids are climbing all over things and splashing in the pool, and the parents are sitting on the picnic table and not doing anything. So we have proposed that we buy a play structure for Seroptimus Park, because they already have the track there. They have the admittedly dilapidated exercise equipment there. They've got the new disc golf course. They've got a lot of good stuff for adults and older kids to do, but the littles still need something. So that's what we are proposing. We're also proposing that we have some kind of activity there, and this is where I'm hoping to get a little input from you guys too, because I've thrown it out to the clinic staff, but why not go wider? So we want to partner with, say, the youth mentors or the extension service or the disc golf people whose name I forget, to have some kind of events happening at Seroptimus Park, and this will kind of bring it to mind. I mean, I grew up here, and it's just one of those places that I don't really think about that much. Like, I know Seroptimus Park is there, but you don't, like, yeah, Kristen, you're here. Like, you don't go to Seroptimus Park. So the goal is to try to change that by having some of these family activity pieces.
What about having a dog park?
I don't know, I haven't been to Stratford Park.
But I mean, you don't always have to have a very large area for that, but there is no dog park in here. And all of our signs say no dogs in the parks, and they're all the time in the parks because a lot of people don't have large backyards.
Yeah.
And so they're wrangling their dogs and they're throwing stuff for the dogs to fetch and stuff right over in the park that says plainly no dogs.
Yeah.
And I wondered if the reason we haven't done it yet is because of like insurance or something? I mean,
Probably, yeah, I don't know.
I don't know.
But
But it certainly is a draw for some people that don't necessarily otherwise interact with, you know, with human beings.
So maybe that's something you can bring up. So Arvinder tried to go to town council this week because we need the town to sign off on this. They didn't have quorum, so that went nowhere. So the next meeting is January 8th, which is going to be a fun meeting with new town council members sworn in. So Arvinder's gonna make the pitch then, and he's gonna send out information before that to the incoming town council members and the people who are gonna be on there, just so he doesn't have to explain everything from the beginning on that already busy meeting. The piece that I'm hoping for a little input on, so Paul pointed out with the last meeting, and he didn't do it quite this bluntly, but we need to be able to sell this to EOCCO. And to do that, we need to be able to quantify what the impact, so we can't just buy a playground equipment and leave it at that and say that we've done something. We have to be able to show EOCCO that this is making an impact on our goal of getting families to be more active together and that it is benefiting our EOCCO population. So how do we do that?
So part of our hiking program, and I'm doing hiking in quotes, because John and I initially were like, oh yeah, hiking, like up the canyon hiking. And then we realized if we're targeting people with children 5 and under, you can't, I mean,
Right,
kinda hard to
stroller
strap a
doesn't
baby
go.
to yourself. So we're gonna work on creating like a brochure of where in Lake County and Lakeview, you can just walk.
Nice.
The trails, Sir Optimus Park would be one of them.
Yes.
So I'll talk to John and see if maybe we can consider it like an Outback Strong partnership and throw the Outback Strong logo on all of those materials.
Love it. Thank you.
I think we talked about a little bit holding some specific events that we market really well. And then being able to send out post-event surveys to those EOCCO members who we know attended, because we're gonna obviously keep track of those attended, so that we can do that. And you know, there's a couple other things I think we can do, but it's sometimes hard to tag them as EOCCO members if we don't know exactly who's reporting, but we have their addresses and we can mail them surveys and call them and remind them to send them back first, and then that $2 bill or whatever it is that we're gonna pay to get them to.
If we do that, we have to
Turn our surveys.
work the budget, so there's that piece that we may not have in this budget, so that's the, we have to come up
Move forward.
to those. The team has been, I'm running this by Sam Kurtna, who is at Oregon Health and Science University. She's our program officer, our go-to for all things related to the grants. Just to make sure that this, I don't know if she'll be able to offer any kind of guidance. I threw out the idea of sending targeted mailings in addition to, if we market events at the park, in the newspaper, on the radio, on social media, that's not targeting our EOCCO members, that's broadcast. So I suggested the targeted mailings. The clinics were not enthusiastic about this idea.
We weren't? No. I don't mind mailers. Any mailers.
Okay. That's just another.
Mailers are easy enough.
Do we have a backup plan? Since your deadline is looming and we're not gonna get to talk to the city till the 8th, is there a backup plan if they won't go for it? And
that's part of why we're sending this out earlier, so to get a little feedback. Talking to our town manager is very enthusiastic about the idea.
Okay.
Darwin, who is doing all the things and can't be here, is behind it, so we think we'll have the support. Bart Snell is the name of the disc golf guy, and he said they were all for making improvements to that park. Like, it's on their to-do list, they don't have funding, they don't have the will to do it for, so.
I think
So if you targeted Head Start,
Partner with Head Start.
Yeah, I'm just, that's how they got it's like a wooden kind of track thing, all-weather pathway that kids could ride and.
Cool.
But they justified it by Head Start having to do quarterly height and weight assessments on all their kids.
Oh.
So they're required to do that for the feds, and there's the data that's already collected. And if they're in Head Start, they're likely to be EOCCO plan members.
And because
So I mean, just somehow funneling or
Well, that's
linking Head Start to the improvements in that park would be.
And you can get probably on their questionnaires, because they have to meet with those families every quarter, no matter what, whether it's in-home or at the facility, getting a question, have you visited this park? Or what, maybe they would be willing to throw in a question for us when they're having those. I think also doing maybe a grand opening event with healthy food, since that's what we're promoting, maybe, I don't know if we've already budgeted the budget for this, but something of that nature that we know at least one big event that we're gonna do, invitations that we're gonna mail out to all of the EOCCO members.
That's cool.
Something like that might be a way that we know we're gonna get some bodies.
I'm guessing you're partnering up with like the regional parenting folk or whatever.
Oh, we should talk
Like-
about the hub.
like-
Are you part of the hub?
Because, he's part of the hub. Yeah.
Early learning hub?
Yeah.
Yeah.
Yeah, because you've got the library and a bunch of folk on there that again, healthy families and all those guys that would totally fit into that same thing and may have something similar to what you
Yeah,
guys are
Head
talking
Start is
about
a
with
great
Head
idea.
Start.
Yeah, there is.
I understand that our Head Start numbers are down a bit because of the something to do with the minimum wage being, and so they don't qualify because the minimum,
They'll
because,
fill their slots even if you don't meet, and
Okay.
you go on the waiting list.
okay.
I did see an ad, I think this week in the Examiner, that they have spots available, so.
Yeah, they fill a certain number of 3-year-old and 4-year-old slots, and typically they have, it's one or the other. One of the slots they have a harder time filling, I think it's the 4-year-old slots. And what happens is they have a certain number of income eligible slots, so if you are under the minimum income, then you have first dibs at those spots. But if you have placed all of your income eligible children, over income families are allowed to have their children.
Cool.
And even if you're over income and your child has some other qualifying events, like they have a different, maybe they have ADHD or they have something else that goes towards their points on their score, so the child could get placed even if they are over income.
Oh, good.
So, a couple other.
And I'll pitch the idea in the next early learning hub meeting.
Cool, thank you. The only concern about Sorokin Park is the cougar apparently lurking occasionally in the area, but.
Oh, yeah, didn't you see them the other day?
Yeah, they just.
Yeah, they kept the kids in.
Yeah, the kids are all gonna be trained in cougar drills, so we should be.
Get big.
Not like the.
We heard one last week, like right in the neighborhood, Center Street and K, right in there. And we're like, what? There's no way. That was definitely a cougar. And my husband ran outside, couldn't see anything. And then they saw in the newspaper the sighting here, and he was like, see? It was definitely very loud and very cougar. It was not a cat.
A couple of months ago, there was a cougar killed in the Dalles hotel room.
What? I heard that. I heard that.
They're
In
coming
a
down into
hotel room.
towns.
It was kind of under renovation.
In a hotel room?
Yeah.
Whoa.
Yeah. Wow.
Wow.
Crazy.
Yeah.
So Christie, I do think it would be appropriate for the group to give you a nod here
Okay.
so that it's not reconsidered back in January before it's too late to
Yeah,
refix
right.
that this
Yeah.
is the track that you want.
Yeah.
So I'll touch base too, I skipped over the north end where we're gonna address the kids who don't have access to fruits and vegetables. I don't remember if you asked this or St. Curtin it did. So LaPine Community Health Center has an existing voucher program where if you meet a certain income requirement and you have a diagnosis of diabetes or obesity or high blood pressure or what have you, something that eating healthier foods would help, then they will prescribe vouchers to those patients. This will expand on that project, and they're gonna be targeting kids who don't have that access to fruit and vegetable, who have the income requirement and have some kind of condition that would benefit from eating more produce. We talked about the idea of partnering with the Frontier, the GRX programs, and because they already have this in place, they already have agreements with vendors, it just seemed better to piggyback on the existing project. Shelley and Kathy, when she was still there, talked about the importance of giving these kids a goal too. We call that counseling for physical activity and nutrition. We call it childhood obesity, but really it's the opposite problem up in North Lake where they have a lot of malnourished kids. And so setting a target like gaining weight, trying to get into a healthy weight range might still be a really good goal for kids. But they thought that having a goal would be more meaningful and seem like less of a handout, I guess, to families up in North Lake. So that will be part of that project as well.
There's been a lot of research around weight,
Yeah.
tons.
Yeah.
Setting something more than 5% is not a good goal, so keep it small.
I'm gonna keep that in mind for my own resolutions.
5%, you know, if they're trying to gain weight or lose weight, I mean, don't go more than 5.
And I think, like, we're not gonna put that in here, it'll be on a,
Right,
with the provider and the
individual.
individual, yeah,
Okay.
so that's that piece of the puzzle. So that is the whole plan, so, yeah, if you guys do wanna, do we have a quorum, do we need a quorum? But, yeah, if you guys, this does require a vote because this is the LCAC plan, this is the LCAC dollars.
So we need a move, a motion,
Motion?
is that right?
That's our leader.
Yeah, let's do a motion. Does anyone want to? Do you have a motion?
I move that we,
Yeah?
I move that we accept the draft from Christy Albertson for next year's EOCCO LCAC grants, providing that the little bits of information that are empty will get filled, and understanding that some revisions are yet to be made, but that timeliness is important. She seconded.
Oh, I was coughing.
Yeah.
Yeah.
Thank you, Christy. So we are about running out of time. Does anybody want to share any updates?
Did you vote?
Yeah, you need to vote.
You have to vote on that.
Yeah.
Oh,
All in
okay.
favor of?
So we got the motions, right?
Yeah.
Right.
Okay, so everybody with the motion say aye.
Aye.
Anybody against the motion say aye. Perfect, so the motion has been approved.
Can you give me a quick rundown of opt-ins that you're going to?
Yes, we are looking at the Alice WellCare, colorectal cancer. We're gonna add Christmas Valley to that
Okay.
for next year. We're not doing population health. I have to talk to San Pertna about ED utilization. We got started late, so we don't know where we're at yet with that. So
Okay.
we'll follow up with you and San Pertna. And then we're gonna go after the new ideas grant as well.
Oh, good. Excellent.
We may or may not do that right with this deadline. We might go for the next one.
All right, thank you.
Thank you, Christy. Diane, did you want to share? Oh, I thought you, okay. Yeah, so quickly, does anybody want to share anything, any updates from the organization? So perfect, so I'll, well, not perfect, but, so I'll adjourn the meeting and I wish you all happy holidays, Merry Christmas and Happy New Year.
Thank you, you too.
You too.